All right, Doc, on with the next question with microbiology. I chose this one because it talks about virulence factors, and I want to make sure you all understand that when it comes to microbiology, they're going to ask you either bacteria, viruses, definitely pharmacology, and virulence factors are something that if you can just understand and master, you can definitely get easy points on the exam, and that's why I want to drill it in your minds that micro is one of the few areas that you can just push hard and leverage for exam day, okay? So like we always mention in all the questions, let's read the last 3 lines first and see what we got. The pinprick sensation is decreased bilaterally to the level of a mid-tibia. A culture of the wound grows beta hemolytic, coag positive cocci in clusters. The causal organism most likely produces which of the following virulence factors? So now we see coag positive, in clusters, beta hemolytic, that has to spark something in our minds, right? Is it staph? Is it strep? Now, strep has alpha, beta, gamma hemolytic, but it's not coag positive. It's staph that's coag positive, okay? So when you are studying, and again, if you're realizing you're answering questions and you're not really connecting, you don't know the details too well, you might need to stop, put this on pause, go back and read and understand the material, then use these videos to help you leverage the exam. Because if you don't know what beta hemolytic means, or you don't know the difference between staph and strep, test taking can't help you because you need to know at least some of the information, right? So that's why either you read the scenario and get the right answer, or you have enough knowledge in the other answer choices to use your skills to knock them out and figure out where, if any, are there any other points of entry for the exam, for the particular question in the exam, okay? So beta hemolytic, coag positive, got that. Let's say we don't know exactly 100% what it is. It's okay. All right, let's go to the top and see what we can get from reading the question. A 62-year-old man comes to the physician because of oozing skin ulcerations on his foot for 1 week. He has a history of type 2 diabetes and does not adhere to the medication regimen. So when they say this, when they mention that, they're not compliant, they're not adhering to the medication, he hasn't checked his HbA1c, they're just saying, hey, it's not controlled, and because of that, there's going to be complications, right? So now you think about a diabetic person, peripheral neuropathy, issues with ulcerations, what kind of organism is usually the cause of these kind of infections, right? So a physical exam shows purulent discharge from an ulcer on the dorsum of the left foot. So they're trying to lead you to think diabetic patient, not taking his medicine as it's clearly stated here, and the organism that is most commonly infecting the patient that has diabetes and it's not controlled. So you have to think it's staph, okay? So that being said, being that's also coag positive and it's in clusters and beta hemolytic, even though we know that strep has alpha, beta, gamma, staph also is beta hemolytic, okay? So now we know the information, and now these are many different virulence factors listed here. So I can't stress enough, you have to know some, if not all of these. So one by one, protein A, what could that be? Well, it's Staph aureus. A for aureus, A for protein A. P. fimbriae, that's E. coli. Exotoxin A, there's a nice mnemonic, PEEP for Pseudomonas, and one of the E's is exotoxin A, so that's Pseudomonas. And I've mentioned this before in previous questions, that you need to use the mnemonics in first aid. It's going to help you literally have that leverage for exam day. Ureus is Nocardia. IgA protease, there's 3. IgA proteases are found in strep pneumo, H. influenza, and Neisseria species. Also think of the mnemonic SHIN, SHN. And this is a bad one, meaning what these organisms do is they use IgA proteases to go in and allow themselves to live rent-free in our mucous membranes, right? That's why you have IgA protease allows them, strep, H. influenza, and Neisseria to be living in the areas where it's mucous membranes. And M protein is a virulence factor for strep pyogenes, which is a beta hemolytic. And I can see somehow people choosing this answer because you see beta hemolytic. Be careful when you read. And I know you and I are just doing it now, but when you are sitting down and it's timed and you're exhausted and it's many, many questions upon questions you're answering, you might just read beta hemolytic and stop there, not realizing coag positive isn't strep and also it's in clusters, not in chains, right? So this is more staph. But I feel that M protein people probably would have chosen, and we'll see the numbers here because it is a beta hemolytic, but this is more for strep pyogenes. And there's a good question also in AMBOSS about strep pyogenes. If you come to it eventually, there's many different virulence factors. So when it comes to staph and strep, please take your time and learn the information. I can promise you it will get points on exam day. And lethal factor, I think that's Bacillus anthrax. So now out of all these, we're going to go for protein A is staph. Now I know I may make it look easy, but it's not, but it is, if that makes sense. It's not because you need to know the information. If you come to me and say, Dr. Stavros, I'm not exactly sure what organism it was, well, there's so many to choose from. So if you find yourself having difficulty, then you stop and read every answer choice. Really understand, take notes, and figure out, okay, which one has protein A, which one has so on, so on, so on. And then you might have to take a step back, like I mentioned in many of our videos, because test taking skills can only be applied if you at least have some basic knowledge on the material, because there's instances where there's stuff written in the scenario that you have to see that can help you leverage, but there's other times, like now, you needed to know what beta hemolytic was and coag positive, and knowing that Staph aureus is the most common pathogen that's isolated from a diabetic foot ulcer. And because they wanted you to know this, they purposely said, hey, this patient is not taking their medication. Taking it one by one, I can promise you they love asking questions about Staph aureus with this region of IgG antibodies. I don't know why they asked it, but they always do. Know about opsonization, phagocytosis. You need to understand, we as humans need to know how these organisms work in order for us to produce certain antibodies and medication to kill them, right? So virulence factors are what organisms have to protect themselves from us. So for us to get them, we need to know what they have so we can break it down. And that's why it's very, very important. So you see how tricky it could be? Because you can have a scenario and you know it's TB, you know it's pseudomonas, you know it's staph, and they ask you about a small virulence factor or medication, or the medication you prescribed its side effect, and you're like, oh man, I knew the differential. I know you knew it. I know you know it, but do you know everything else that is involved with that particular organism? So take it one by one. 16% went for exotoxin A. I know why, because a lot of organisms have different type of toxins, but this exotoxin A specifically affiliated with Pseudomonas, and it deals with inactivation of elongation factor. There's another one, elongation factor 2. This one is Pseudomonas and C, diphtheria. They both have similar elongation factors involvement in both, so be careful for that. Urease here, we have here is Spinocardia and Peptostreptococcus. IgA protease, as I mentioned earlier, SHN, Shin, Strep pneumo, H influenza, Neisseria, very important. You need to know that this basically, it allows, like I mentioned earlier, organisms to evade and to really adhere to the mucous surfaces because they cleave the IgA. So they are allowed to adhere to all the mucus areas because they cleave the IgA that would have got them to begin with. So M protein, this is pretty big. This is strep pyogenes. This is something you must know. They love asking you questions about staph and strep, especially when it comes to skin infections, to rheumatic fever. So if you feel iffy about that, please take your time now, invest the time. I promise you it's going to pay off. Don't assume you read it and you'll look at it later and maybe you won't get it, because there is no hope with me. I hope you know. If you know me and you know me well, I never say, I hope I don't get the question. Expect that you will get the question. And if you don't get it on exam day, that's nice. But you don't want to hope for something and actually get slammed with multiple questions and then realize you could have had a higher score, you could have passed, if only you put extra work and time into understand the concepts here and the information. This lethal factor, 1% was anthrax, no big deal, but they throw it in there as well. P. fimbriae is E. coli, the different types of E. coli, but you realize if you understand beta hemolytic, coag positive in clusters, that there can lead you to a point of entry to say, you know what, I know that's Staph aureus. But then the tricky part is, do we know the virulence factors associated with different organisms? You know, it'd be nice to have them listed here, or they have listed here all the organisms, but it's never usually that way. They either give you the organism in the scenario, they either lead you to a profile so you know what this means, aka the particular organism, and they want you either the medication, the virulence factor, the MOA of the medication, or the adverse effect to the medication. So I promise you, micro is definitely an area that you can increase your score, as well as immuno and biochem. That's why we put these videos together. You'll see many, many more cases when I do them in these video series, and also live in our webinars, because not only do you have to read the content and kind of familiarize yourself with the material, but then you have to practice reading these scenarios and seeing the little areas that you can enter and leverage to your advantage. So to summarize, they're talking about diabetic patient who is not compliant with their meds. Most common infection for diabetic foot ulcers is Staph aureus. Know as much as you can as for Staph aureus. Protein A for aureus, A for protein A. M is definitely something that people always mix up. Strep M is for strep pyogenes, which is a beta hemolytic. A quick little tip: alpha, beta, gamma, B beta, so beta hemolytic. B for group B strep. And also group B, the word group triggers group A. So you have group B strep, group A strep for beta hemolytics. And you see that chart in first aid. You have alpha, beta, and gamma. So I was going down in the middle. I see B for beta hemolytic, B for bacitracin, B for group B, and the word group, I also trigger A. So group A, group B. And I know this might not make sense sometimes to you, but I will show you all the tricks that I have, that I show my students, because this is exactly what you need to do to put the pieces together, to anchor the information so you don't have to memorize. If you memorize, doctor, I'm telling you, you're going to forget it next week. Okay, there's so much information to memorize, it's not easy. So Staph aureus, boom, protein A. Strep M, M protein, strep pyogenes. So little things like that will allow you to remember the information, trigger a synapse, some connection, and then be able to recall it on exam day. All right, so try that out. Keep pushing hard on doing questions, and I'll see you on the next question.